Are you? You gonna go?
Yeah, for practice.
Oh, okay.
If we practice with the sheet, then we're gonna expect to hurt. You need to practice with the sheet because you won't know,
What we're
especially
doing.
the first time, you won't have no idea what you're doing.
You gotta wean yourself off.
And I want to make sure I'm telling you step by step so you won't get confused. Because my assessment when I'm on the floor, I'm just boom, 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 boom. So, okay. Hi, Miss McQueen. I'm Danielle. I'll be your nurse today.
Hi.
How are you? Good. What brought you in here?
I'm having severe stomach pain.
Okay. Is it getting better?
No, it's awful.
Oh. Well, we need to take care of that. Well, I'm going to perform your assessment, but when I finish, I'll go call the doctor and just let him know you're having some pain, okay?
Okay.
All right. So I'm going to do a full assessment on you. That entails me assessing from head to toe. Okay? So I may have you doing some turning for me, but it won't be painful at all. Okay? All right. So I've gathered my equipment. I have my pen light. I have my stethoscope. I've washed my hands. And I've provided privacy. Curtain pull. Okay, I've already talked to my patient, asked her why she's here, if she had any concerns, if she addressed that. So now I'm looking at her overall appearance. I'm just gonna pull this down, just looking at you, making sure you don't have any breakdown on your arms or legs, okay, looks good. And can you tell me your name and your date of birth?
January 24th.
Okay, do you know where you are right now?
Yeah.
Where?
I'm in Daytona.
Daytona? You know what day of the week it is?
Thursday.
Thursday. And what major holiday is coming up?
It depends if you consider Valentine's Day major.
Oh, okay. All right. So she said Valentine's Day, so that's okay. So we're good. And so I'm looking at her hair, and I'm inspecting her scalp. So you'll actually get physical and use your hand. So I'm looking for any rashes, lesions. I don't see any breakdown. Looks nice and moist. So that's fine. I looked at that. And so I'm going to ask you to follow my pen light, and I'm just going to check your eyes to make sure they're okay, all right? All right, I'm just shining the light. Good. Oh, you don't have to actually follow for this, but just look straight. So I'm shining the light, shining another light. And can I have you just look at my pen? So that's accommodation. And then I'm going to ask you to follow this, okay? Now you'll follow it. With your eyes. Good, very good. All right, so can you open your mouth for me? And I'm looking in here, and I have my pen light, and I'm shining, looking, make sure it's nice and moist, teeth are good. And I'm just looking at her chest. Can you take a nice deep breath for me? She has equal chest expansion. And now I'm going to listen to her lungs.
Can you do that outside? Well, no, I know you can't, but just so we can see where you're placing it.
Do what outside?
Like, where you're placing the stuff.
Yeah, that's what I'm about to do.
Oh, okay.
What are you talking about outside?
She wanted to do it. She didn't want to put it in my shirt, so you.
Oh,
So
yeah.
I can see where you're
Oh, no.
placing
Because you can you can listen outside,
Oh, you
even in
can?
the real setting. Yeah. Oh, yeah, because you can still hear it. Unless they have on a thick sweater or something, then it may be odd, but yeah, you can listen on the outside. Test it out, make sure you can hear something. All right, I want you to take a nice deep breath for me. Nice deep breath, big breath. Good. Again. For a female, your second one may have to be under their breast. Again. Nice deep breath. All right, sit up for me. I'm gonna listen to your back. So I'm literally going up, both lobes and lower lobes. So it's like a big square.
So you did 5 in front. Did I have 5?
I did here, 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 and then your lateral is more so back there,
Okay.
and here, and here.
Okay.
Sometimes you can hear it like here and here, more so on the breast, but it depends on the female.
Just 5 in the front and 4 in the
it's really not 5 per se. It's more so like 3 areas you listen to in the back, but remember you're doing bilaterally. So 1, 2, 3, and then the back is 1, 2. All right, nice deep breath. Again. Big breath. One more time. How are you breathing? So her lungs are clear, anteriorly and posteriorly, in all lung fields. And now I want to listen to your apical pulse. So your heart, unless you have a unless you were born with your heart on the right side, it should be on the left. And some people are born with it on the right. That's why I say that. So you're gonna make sure I'm gonna feel for your apical pulse. So I'm gonna feel her intercostal space. Sorry, my hand is cold. 5, and then it should be somewhere over here. Are you alive? Okay, hers is right here. So that's it's normal. Yeah, it's normal. It's nice and steady. So I've done her apical pulse, and now I'm gonna feel for her brachial artery. Okay, and then her radial. And then I could come over here to the opposite side. Yeah, just feeling it. All right. So we want to do the capillary refill. I'm just gonna squeeze on your nail bed and let go. So hers was less than 3 seconds. Less than 3 seconds. And then I want you to grab my hands and just squeeze. Good. Equal strength. Can you take your arm and rotate it like that for me? How about your other side? Can you bend it like a muscle? Extend it out? Great. Perfect. Then I'm looking at her abdomen. I'm just going to lay you down. Because I'm going to assess your stomach. I'm going to look at it, listen to it. At this point, if you do adjust the bed, if you go out of order with this and say, when was your last bowel movement, when's the last time you urinated, that's fine. And if you miss a step and you were to say, if I've done all of this, and say for instance I forgot to listen to the apical pulse, then if you were to verbalize it and say, oh, after I do this, I'm gonna go back up here and listen, that's fine too. I want you to try to go head to toe, but there are instances to where you do forget something. But if you remember before your eval is over, then that's fine. I'll still check you off on that part.
Does the eval, we get 2 tries for that, right? Just like with the other thing?
Yeah.
Okay, so say we miss something on upper extremities. Will we have to hit all the upper extremities or just that one thing we missed?
Just the one thing you missed.
Okay.
Yeah.
Perfect.
And what I'll do after your eval is over, I'll say, now think about something in the head area that you may have missed. And then I'll just give you an opportunity to kind of think, and some people, go over the steps in their head, and they're like, oh, I forgot that. And then they'll say it. So I'm looking at her stomach. I'm actually going to feel. You want to ask her, does it hurt in any area? No?
It's supposed to hurt, but no, it doesn't hurt.
So you're checking it for softness, firmness. Like I said, if it's distended, it would mimic like a pregnant belly, not normally that you would see on the patient. It can be round, firm. And then you want to listen to her vowel sounds. So this is the right lower quadrant. And what you're listening for is a gurgle. All right then. Right upper quadrant, left upper quadrant, and left lower. So our vowel sounds are active in all 4 quadrants. Excuse me, it took a while at first because this obviously didn't work. But yeah, you have some gurgling going on. If you have a patient who's recently had abdominal surgery, this is very important to do because anytime you have major abdominal surgery, it slows down your bowels. And so you want to definitely pay attention to it because we need to make sure they're back working again. So that's something that you want to focus on, more so for those patients because the doctors will ask you. So we've done that. Now I'm looking at her lower extremities. So I want to feel for her femoral artery. You don't necessarily...
You didn't ask her the last time.
I did.
Oh,
Yeah, I asked her while I was lowering her head. You didn't give me a response, but yeah. So your femoral artery is on your pubic line. For the purposes of this, you don't have to touch it because I know, it's a little personal, but it's more so in this area. If you're in the real setting, you do get a lot personal, so you're going to actually feel for it. So it's more so here, your femoral artery. I don't know if you can see me. It's there. And then I'm going to look for a range of motion. So I'm going to have you move your leg out for me this way and in. And can you, thank you, and bend and extend. And that's her range of motion for her lower extremities. Then I'm looking for her pedal and posterior tibial. Your pedal pulse, you want to have them take off their shoe if they can. Your pedal pulse, bend your foot for me, is here at the top of the foot. Your posterior tibial pulse is here on the side. So you actually want to feel for that. And then I'm looking at her ankle, make sure there's no edema, so you're feeling. Make sure there's no swelling. If she were to have her socks and if her shoes and socks off, you will actually look for it. And in the real setting, you want to actually do that for a patient. You want to look at everything. And if she had edema, I will put my 2 fingers here and press in. And if my fingerprint stayed there for greater than 10 seconds, she has pitting edema. So you would assess the degree. And then dorsiflexion against resistance for strength and symmetry. So I come down here and I say, can you push on my feet like you're driving a car? And you just want to see if it's equal. That's all you want to do. And then you can say, push back for me. And then that's fine. What's wrong? What did you say? Nothing. And then your calf. Look at your calf. Make sure there's no redness, no tenderness. Feel back here, see if there's any hard area. And if there's not, then she's good. So she's probably not at risk for blood clots. But a deep vein thrombosis, it can occur down there. So you want to assess for that. And then I do my capillary refill down here, down here. Make sure there's blood return. And then I can document on my physical assessment form during practice, and you can go over it with the patient. So you can say, okay, everything looks good, but I noticed that your vowel sounds were kind of sluggish in one area. So I'll mention that to the doctor and see if he wants to do anything about it. And then I'll address your pain with him as well to try to get you some medicine. And that's pretty much it on your assessment.
So we just need to make sure we're hitting stuff. We don't need to say, okay, this was a whatever's on our note sheets. Do we have to say, oh, well, the lungs had wheezing? We're just checking?
You're
Okay.
just checking.